Hello students, today we will learn the hypothyroidism. The thyroid gland is located in the neck, below the thyroid cartilage, and consists of lateral lobes on either side of the trachea and isthmus across the front of the trachea. The adult thyroid weighs about 20 to 13 grams. Iodine intake is regulated by the hypothalamic thyrempin-releasing hormone pituitary enterocypothyrompin feedback axis for thyrosis and the secretion of thyroid hormones. Hypothyroidism or hypothyroidism is an endocrine and metabolic disease. It refers to a group of clinical syndromes that excessive thyroid hormone in blood circulation causes increased excitability and metabolic hyperactivity in nerves, circulating and digestive systems. Primary hypothyroidism, that is diffuse toxic goiter, accounting for about 18% of hyperthyroidism. The main performance is diffuse enlargement of the thyroid gland. At the same time, appear hyperfunction. This disease is more common in women. The ratio between men and women is 1.426 to 20 to 14 years old, most see. Slow onset. The performance is the swelling of pituitary system and the diffuse sex of gland, often accompanied by eyeball protrusion, also known as exophthalmic goiter. Secondary hypothyroidism, about 10%, such as secondary to nodular thyroidism. The patient has nodular goiter for many years before the emergence of hyperfunction, the onset of age more than 14 years old. Nodular gland enlargement, biliary chemistry, no producing eyes, easy to occur, myocardial damage, high function ammonia, about 5% single or multiple independent high function nodules in the gland, surrounding thyroid tissue atrophy, no protruding eyes. Let's look at the diagnosis. Many rely on clinical manifestations combined with axillary examination. The commonly used axillary examination methods are as follows. The first one is determination of basal metabolic rate. Basal metabolic rate should be measured in the awake, empty, and quiet state. The use of basic metabolic rate analyzer, the determination of the result is accurate, but the need for special instruments and equipment. So the clinical common formula method to calculate the basic metabolic rate. Basal metabolic rate equal pulse rate plus pulse pressure minus 111. It should be noted that the pulse rate and pulse pressure in the formula need to be measured in the basic state. Judgment of calculation result. Normal range plus or minus 10%. Increased basal metabolic rate to plus 20% to 13% indicates mild hypothyroidism. Plus 13% to 16% indicates moderate hypothyroidism. Over 16%, several hyperthyroidism. Determination of iodine uptake rate of thyroid. Determination of T3 and T4 in serum. Thyroid stimulating hormone. The change of serum TSH concentration is the most sensitive indicator to reflect high thyroid function. Treatment of hyperthyroidism. The treatment of hyperthyroidism includes anti-thyroid drugs therapy, radiation 101, iodine therapy, and operation. Drug therapy is the basic treatment of hyperthyroidism. and is also used in the preparation stage before surgery and 101 treatment. However, the cure rate of drug therapy alone is only 14%, and the recurrency rate is as high as 15% to 16%. The cure rate of 131 for hypothyroidism is over 85%, but hypothyroidism is an inevitable result. Surgical treatment for hypothyroidism. Most thyroidectomy is generally selected for hyperthyroidism. The current rate is 19% to 95%, recurrence rate 4% to 5%, mortality rate under 1%. The major complications of surgery are permanent hypoparathyroidism and nerve damage resulting from surgical injury, but the incidence can be reduced to less than 2% when performed by an experienced physician, and as high as 10% to 15% when performed by an inexperienced physician. Therefore, stricter grasp of surgical indications and contraindications, complete and adequate perioperative management by experienced surgeons. These measures can reduce the occurrence of postoperative serious complications. Let's take a look at the indications for surgical treatment of hypothyroidism. Secondary hypothyroidism or high-function adenoma, moderate or above primary hypothyroidism. The gland is larger, accompanied by compression symptoms, or retrosternal goiter and other types. Patients with relapse or long-term medication difficulties after retreatment with anti-thyroid drugs or 131. For patients with hypothyroidism in the first and second trimesters with the above indications, surgical treatment should be considered without termination of pregnancy. Adolescent patients. Mild symptoms. Elderly patients or patients with serious organ diseases who cannot tolerate surgery. Choice of surgical method. It's mostly posterior hypodectomy. The scope of excision includes the amount of gland excision depends on the size of gland and the degree of hypothyroidism. Insufficient excision, post-operative hyperthyroidism, recurrence, excessive excision can cause hypothyroidism. Usually 18% to 95% of the lateral lobular glands and all the isthmus are excised, while the back of the lateral lobular is reserved, which is helpful to protect the parathyroid gland and the recurrent laryngeal nerve. Now let's look at the preoperative preparation for hyperthyroidism surgery. Thyroidectomy is an elective operation except in a few exceptional cases. Therefore, complete and adequate preoperative preparation should be made. First of all, general preparation improve the patient's nutritional status and eliminate anxiety and fear. Improve preoperative examination include cervical radiography to know whether the trachea is under pressure, ECG examination. Laryngoscopy was performed to determine vocal cord function and evaluate the cause of postoperative horizons. Determine the basal metabolic rate to understand the degree of hypothyroidism. Medication preparation. Drug preparation is an important part of preoperative preparation. There are three main methods of medication. The first method, combined use of anti-thyroid drugs and iodine. Specific method of medication is to use antithyroid drugs and UVA-type treatment to be basically controlled hypothyroidism symptoms. Iodine agent for 2 weeks. The second method, iodine alone. This method is suitable for moderate primary hypothyroidism, secondary hypothyroidism, and high-function adenoma. After using iodine 2 or 3 weeks, the operation will be performed after the symptoms of hyperthyroidism are basically controlled. Some patients can continue to take iodine at the same time and then use IOU-track drugs until the control of hypothyroidism symptoms. After the control of hypothyroidism symptoms, stop using thyroid drugs and then continue to use iodine alone for 1 to 2 weeks after surgery. The third method, the use of propranolol. Propranolol can be used alone or in combination with iodine if the above two methods are not tolerated or effective. Here's a look at some of the issues you should pay attention to when using iodine. First, thyroids. While antithyroid can cause hyperemia and enlargement of the thyroid gland, which increases the risk of bleeding and injury during surgery. The use of iodine can reduce the blood flow of the thyroid, so that the thyroid becomes small and hard, easy to operate. Therefore, iodine should be routinely used after preoperative preparation thoracic. Secondly, the main function of iodine is to inhibit the release of thyroxine so as to relieve the symptoms of hyperthyroidism. Patients with mild symptoms of hyperthyroidism can directly use iodine for preoperative preparation. After discontinuation of iodine, the thyroglobulin originally stored in the thyroid follicles is greatly decomposed, and the symptoms of hyperthyroidism can recur, even more severe than the original degree. Therefore, patients who do not plan to undergo surgical treatment should not use iodine. Third, the use of iodine. Our clinical commonly used iodine agent is mainly compound potassium iodide solution, also known as Lugo iodine solution. Method of administration: 3 times a day. Start with 3 drops. Will increase 1 drop each day until the maintenance dose is reached at 16 drops, which can maintain the medication for 2 weeks. The specific usage is 3 drops on the first day, 4 drops on the second day, 5 drops on the third day, and gradually increase to 16 drops each time. Please note when taking medicine, each drop of compound potassium iodide contains about 8 mg iodine and iodide, and the dose is about 0.05 mg. The amount of medication is increasing day by day. The operation time should be maintained as far as possible at the maintenance dose of 16 drops each time for the next 2 weeks. Therefore, female patients should pay attention to inquire about menstruation before taking the drug. Iodine is irritating and should be diluted or taken with food. Surgical stress and injury can increase the release of thyroxine stored in the fascias. In order to control the symptoms of post-operative hypothyroidism, iodine should be used after surgery, which can be either of the following 2 medication methods. The first was 10 drops, 3 times a day for a week. The second is to start with 16 drops 3 times a day and decrease by 1 drop each time. Preoperative medication preparation, no matter which medication regimen is chosen, basic control of hypothyroidism symptoms should be achieved. The patient is emotionally stable, better sleep, weight gain, pulse rate under 19 beats minute, basic metabolic rate under 20%. Now let's summarize the surgical treatment of hypothyroidism. Surgical treatment of hypothyroidism has high efficiency, low recurrence rate, and long-term side effects of drug therapy or radioactive iodine 131 therapy. Strict control of surgical indications and contraindications and adequate and perfect preoperative management, carefully operated by experienced surgeons. Through these measures can ensure that surgical patients smoothly operative period, reduce the occurrence of serious complications. In conclusion, surgical treatment of hypothyroidism is a fast, economic, and safe method as long as strict screening and management are done.